because retinoids are bringing congestion to the surface faster. True purging should improve within 6 weeks. If breakouts continue beyond that, the product itself might not suit your skin. Once you've built up tolerance and are using retinoids regularly, maintenance becomes important. Retinoids must be used consistently to maintain results. If you stop using them, the benefits gradually fade as your cell turnover returns to its previous rate. Think of retinoids as a long-term commitment, not a temporary treatment. The longer you use them, the better your results become, with many people noticing continued improvement even after years of use. Retinoids increase sun sensitivity, making daily sunscreen absolutely non-negotiable. UV damage counteracts all the good work retinoids are doing, and your skin is more vulnerable to sun damage while using these products. Use broad-spectrum SPF 30 or higher every single day, even on cloudy days or when you're mostly indoors. This isn't optional, it's essential for both protecting your skin and allowing retinoids to work effectively. Use retinoids only at night, not in the morning. Some retinoids degrade in sunlight, becoming less effective. More importantly, using them at night means you're not immediately exposing treated skin to sun and environmental stressors. Your skin does its repair work while you sleep, making nighttime the optimal time for retinoid application. Morning is for antioxidants and sun protection. Evening is for retinoids. Be cautious about combining retinoids with other active ingredients. You generally shouldn't use retinoids on the same night as alpha hydroxy acids, beta hydroxy acids, or vitamin C, especially when first starting. These combinations can cause excessive irritation. However, once your skin is fully adjusted to retinoids, you might be able to tolerate using other actives on different nights or even at different times of day. Listen to your skin and adjust based on its response. Some ingredients work beautifully with retinoids. Niacinamide can be used alongside retinoids and actually helps reduce irritation while providing additional benefits. Hyaluronic acid is excellent for providing the extra hydration your skin needs while using retinoids. Ceramides support your skin barrier, which can be stressed by retinoid use. Peptides complement retinoids' anti-aging benefits. These supporting ingredients help you tolerate retinoids better and enhance overall results. Pregnancy and breastfeeding require special consideration with retinoids. All prescription retinoids and high-strength over-the-counter retinol should be avoided during pregnancy and while breastfeeding due to potential risks to the developing baby. If you're pregnant, planning to become pregnant, or breastfeeding, discuss any retinoid use with your healthcare provider. There are other safe and effective skincare options available during this time. If over-the-counter retinoids aren't providing the results you want after 6 months of consistent use, consider seeing a dermatologist for prescription strength options. Tretinoin is significantly more powerful than over-the-counter retinol and works faster. Your dermatologist can determine the appropriate strength and formulation for your skin type and concerns. Starting with prescription strength retinoids requires the same gradual introduction, just with an understanding that results may come faster, but potential irritation is also greater. Different retinoid formulations suit different skin types. Cream formulations tend to be more moisturizing and less irritating, making them good for dry or sensitive skin. Gel formulations are lighter and better for oily or acne-prone skin, but can be more drying. Lotion formulations offer a middle ground. Some newer formulations use encapsulation or time-release technology to deliver retinoids more gradually, minimizing irritation. Don't hesitate to try different formulations if the first one you choose causes problems. Storage matters for retinoids. These ingredients can degrade when exposed to light and air. Store retinoid products in a cool, dark place, keeping the cap tightly closed. Don't store them in the bathroom if it gets steamy and humid. Replace retinoid products according to their expiration dates, as degraded retinoids become less effective. If your retinoid product changes color or develops an unusual odor, it's time to replace it. Managing expectations with retinoids is important. While some improvements, like smoother texture and brighter tone, might appear within weeks, significant results for concerns like deep wrinkles or acne scars take months. Most dermatologists recommend using retinoids for at least 3 months before fully assessing results, with continued improvement over 6 months to a year. This requires patience and consistency, but the results are worth the wait. Some people respond better to retinoids than others due to genetic variations in vitamin A receptors and metabolism. If one retinoid doesn't work well for you after giving it adequate time, trying a different type or formulation might produce better results. Don't assume all retinoids will affect your skin the same way. The variety of options available means there's likely a retinoid that works for your unique skin. As we close today's session, let's take 3 final calming breaths together. Breathe in, feeling empowered by this knowledge about retinoids. Breathe out, releasing any intimidation or fear. Breathe in, embracing patience for the gradual introduction process. Breathe out, trusting in your skin's ability to adapt. One last breath in, committing to consistent, careful retinoid use. And breathe out, carrying forward confidence in this powerful tool. Remember, retinoids are incredibly effective when used correctly. Start slowly. Be patient. Protect your skin from the sun. And trust that with time and consistency, your skin will thank you for this powerful addition to your routine. Is essential for body skin exposed to the sun, but choose formulas carefully. Look for lightweight, non-comedogenic sunscreens designed for body use. Mineral sunscreens with zinc oxide or titanium dioxide are less likely to clog pores than some chemical sunscreens. Spray sunscreens can be convenient for body application, though make sure you apply enough. Sunscreen not only protects from UV damage, but also prevents post-inflammatory hyperpigmentation from healing acne scars. If you're dealing with back acne, sometimes called bacne, reaching affected areas can be challenging. Long-handled applicators or spray bottles help you apply treatments to your entire back without contorting. Some people find that asking a partner or trusted friend to apply treatments to hard-to-reach areas is helpful. Don't let difficulty reaching your back prevent you from treating it properly. For stubborn body acne that doesn't respond to over-the-counter treatments, professional help is available. Dermatologists can prescribe stronger topical treatments or oral medications. Prescription retinoids like tretinoin can be used on body skin to prevent clogged pores and reduce inflammation. Oral antibiotics might be prescribed for widespread or cystic body acne. Hormonal treatments like spironolactone or certain birth control pills can help if hormones are the primary trigger. Professional treatments like chemical peels can be performed on body skin, not just the face. Back facials, sometimes called basials, are specialized treatments that deep clean, and treat back acne. These typically include professional strength exfoliation, extractions if needed, and treatment masks. Multiple sessions are usually needed for significant improvement, but they can be very effective for stubborn welcome. And take a moment to simply be here. Breathe in deeply, filling your lungs completely, and then release that breath slowly, letting any tension dissolve. Today we're going to explore something beautifully fundamental: how hydration transforms your skin from the inside out and the outside in. Water is life. This isn't just poetic language, it's biological truth. Your body is approximately 60% water. Your skin, the largest organ of your body, is about 64% water. Every cell, every function, every process in your skin depends on adequate hydration. When your skin is well hydrated, everything works better. When it's dehydrated, everything struggles. Let's begin by understanding what we mean by skin hydration and why it matters so profoundly. Hydration refers to the water content in your skin cells. Well-hydrated skin cells are plump, full, and functioning optimally. They communicate properly with each other, turn over at the right rate, and maintain the structural integrity of your skin. Dehydrated skin cells become shriveled, sluggish, and compromised. They can't perform their jobs effectively. Here's something many people don't realize. Hydration and moisture are related but different. Hydration is water. Moisture includes both water and oils that help seal that water into your skin. Your skin needs both. You can have oily skin that's dehydrated, producing plenty of sebum but lacking water. Understanding this distinction changes everything about how you care for your skin. When your skin is properly hydrated, you'll notice it immediately in how your skin looks, feels, and behaves. Hydrated skin has a natural luminosity, a subtle glow that no highlighter can replicate. It feels soft and supple to the touch, comfortable throughout the day. It looks plump and smooth, with fine lines less visible. It heals faster from irritation or blemishes. It maintains its barrier function effectively, protecting you from environmental stressors and irritants. Dehydrated skin, in contrast, looks dull and tired. It may feel tight, especially after cleansing. It shows fine lines more prominently, even if you're young. It may be flaky or rough in texture. It's more sensitive and reactive, becoming easily irritated by products that normally wouldn't bother it. It may even produce more oil as your skin tries to compensate for the lack of water. Now let's explore hydration from two essential angles: hydrating your skin from within through what you consume, and hydrating your skin from without through the products you apply. Let's start with internal hydration: drinking water and supporting your body's hydration from the inside. Your skin receives water from your bloodstream. When you're well hydrated internally, your blood delivers water to your skin cells effectively. When you're dehydrated, your body prioritizes vital organs over your skin. So your skin is often the first place you'll notice dehydration. How much water should you drink? The old rule of 8 glasses a day is a reasonable guideline, but it's not one size fits all. Your needs depend on your body size, activity level, climate, and diet. A better approach is to drink water consistently throughout the day and pay attention to your body's signals. Your urine color is a simple indicator. Pale yellow suggests good hydration, while dark yellow indicates you need more water. Your thirst is another signal, though by the time you feel thirsty, you're already mildly dehydrated. Don't wait for thirst. Sip water regularly. Create habits that support consistent water intake. Keep water visible and accessible. Have a glass of water when you wake up, before each meal, and before bed. Carry a water bottle with you. Set gentle reminders if needed. The goal isn't to force excessive amounts, it's to maintain steady, adequate hydration throughout the day. Coffee and tea count toward your fluid intake, though caffeinated beverages have a mild diuretic effect. You don't need to avoid them, but balance them with plain water. Herbal teas are wonderful for hydration and can make drinking fluids more enjoyable if plain water feels boring. The foods you eat also contribute significantly to your hydration. Fruits and vegetables with high water content, cucumbers, watermelon, oranges, strawberries, lettuce, celery, all help hydrate you from within. A diet rich in these foods supports your skin's hydration naturally. Interestingly, foods with healthy fats also support skin hydration. Omega-3 fatty acids found in fish, nuts, and seeds help maintain your skin's lipid barrier, which is crucial for preventing water loss. So hydration isn't just about water, it's about a balanced diet that includes water-rich foods and healthy fats. Excessive alcohol consumption dehydrates your body and skin. If you drink alcohol, balance it with extra water. Excessive salt can also contribute to dehydration and inflammation. This isn't about restriction or perfection, it's about awareness and balance. Now let's talk about hydrating your skin topically, the products and practices that deliver water to your skin and help keep it there. The key to topical hydration is a two-step approach, adding water to your skin and then sealing it in so it doesn't evaporate away. This is where the concept of humectants and occlusives comes in. Humectants are ingredients that attract water. They pull moisture from the environment and from the deeper layers of your skin up to the surface. The most famous humectant is hyaluronic acid, a molecule that can hold up to 1,000 times its weight in water. Other effective humectants include glycerin, aloe vera, honey, and various botanical extracts. Products containing humectants are typically serums or lightweight gels. Apply them to slightly damp skin. This is crucial. If you apply humectants to completely dry skin, especially in a dry environment, they may actually pull moisture from deeper layers of your skin, which isn't helpful. But when applied to damp skin and then sealed with a moisturizer, they work beautifully. Here's a simple practice. After cleansing, pat your skin with a towel but leave it slightly damp. Apply your hydrating serum or toner while your skin is still moist. Then, within a minute or two, apply your moisturizer. This layering technique maximizes hydration. Occlusives are ingredients that create a barrier on your skin's surface to prevent water loss. They seal in the hydration you've just applied. Common occlusives include ingredients like petrolatum, dimethicone, shea butter, and various oils and waxes. Your moisturizer typically contains occlusives, which is why you apply it after your hydrating products. Understanding this humectant-occlusive relationship transforms your skincare routine. You're not just slapping on products, you're strategically hydrating and then sealing that hydration in. Let's discuss different ways to incorporate hydration into your routine throughout the day. In the morning, after cleansing, apply your hydrating products while your skin is still slightly damp. A hydrating toner or essence can be a lovely first step, adding a layer of water-based hydration. Follow with a serum containing hyaluronic acid or other humectants if you choose. Then apply your moisturizer to seal everything in. Throughout the day, facial mists can provide a quick hydration boost, though they're most effective if you follow them with a tiny amount of moisturizer or facial oil to seal in the mist. Misting alone, especially in dry environments, can actually increase water loss as the mist evaporates and pulls moisture from your skin with it. In the evening, your routine can include more intensive hydration. This is a good time for hydrating masks, thicker creams, or facial oils that seal in moisture overnight. Your skin is in repair mode while you sleep, and giving it plenty of hydration supports those repair processes. Hello, and welcome to this peaceful moment. Let's begin with a slow, calming breath. Breathe in gently, filling your lungs with ease, and breathe out slowly, releasing the day's tension. Today we're going to explore one of the most powerful but often overlooked aspects of skin health, the profound importance of quality sleep. There's a reason we call it beauty sleep. It's not just a charming phrase or old wives' tale. Sleep is when your skin does its most intensive repair, regeneration, and renewal work. While you rest, your skin is anything but idle. It's actively healing, rebuilding, and restoring itself. The quality of your sleep directly determines the quality of this nightly restoration process. Let's understand what happens to your skin during sleep. When you fall asleep, particularly into deep sleep stages, your body's repair mechanisms activate. Growth hormone is released, which stimulates cell reproduction and regeneration. This is when new skin cells are produced most rapidly to replace the damaged or aging cells at the surface. Blood flow to your skin increases during sleep. This enhanced circulation delivers more oxygen and nutrients to your skin cells, supporting their repair and regeneration. It also helps remove metabolic waste products that have accumulated during the day. This is why you often wake with a slight flush or rosiness. It's increased nighttime circulation doing its work. Your skin's permeability changes during sleep. It becomes more receptive to beneficial ingredients, which is why nighttime is optimal for applying treatment products. But this increased permeability also means increased transepidermal water loss, which is why nighttime moisturizing is so important. Collagen production peaks during sleep. Collagen is the structural protein that keeps your skin firm, smooth, and youthful. As we age, collagen production naturally decreases, but quality sleep helps maintain optimal production levels. Chronic sleep deprivation significantly impairs collagen synthesis, accelerating visible aging. Your body also produces melatonin during sleep, which acts as a powerful antioxidant for your skin. Melatonin helps neutralize free radicals and protect against oxidative damage. It supports skin barrier function and has anti-inflammatory properties. Adequate sleep ensures adequate melatonin production. Now let's talk about what happens when you don't get enough quality sleep. The effects on your skin are immediate and cumulative. After even one night of poor sleep, you can see changes. Your skin looks duller because circulation and oxygenation are reduced. You might see puffiness, especially around your eyes, because fluid doesn't drain properly without adequate sleep. Dark circles become more prominent as blood vessels dilate and the thin under-eye skin reveals them more clearly. Your skin may look dehydrated because increased nighttime water loss wasn't properly counteracted with rest and repair. Fine lines and wrinkles appear more pronounced when skin is tired and dehydrated. Your complexion might look uneven or sallow because cellular turnover and repair were incomplete. These are just the immediately visible effects. The deeper long-term impacts are even more significant. Chronic sleep deprivation, consistently getting less than 7 hours of quality sleep, has profound effects on skin health. Cortisol levels remain elevated when you're sleep deprived. This stress hormone breaks down collagen, increases inflammation, and impairs barrier function. It triggers oil production, which can lead to breakouts. It slows healing, meaning any skin issues persist longer. Chronically elevated cortisol from poor sleep is one of the primary drivers of premature aging. Your immune function suffers with inadequate sleep. Your skin's ability to fight bacteria and heal from damage is impaired. This is why sleep-deprived people often experience more frequent breakouts, slower wound healing, and increased susceptibility to skin infections. Inflammation increases throughout your body, including your skin, when you're chronically sleep-deprived. Inflammatory skin conditions like acne, eczema, psoriasis, and rosacea often worsen with poor sleep. Even normal skin shows increased inflammatory markers after sleep deprivation. Your skin barrier becomes compromised. Studies show that just one night of poor sleep can impair barrier function, leading to increased water loss and decreased ability to protect against irritants. Chronic sleep deprivation keeps your barrier in a perpetually weakened state. The visible signs of chronic sleep deprivation accumulate over time. More pronounced wrinkles and fine lines, loss of elasticity and firmness, uneven pigmentation and persistent dark circles, dull, lackluster complexion, increased sensitivity and reactivity. These changes aren't just cosmetic, they reflect real damage at the cellular level. So how much sleep do you need? Most adults require 7 to 9 hours per night for optimal health, including skin health. Some people need closer to 7 hours, others closer to 9. The key is consistency, going to bed and waking at similar times each day, and quality, spending adequate time in deep, restorative sleep stages. Quality matters as much as quantity. You could spend 9 hours in bed, but if you're tossing and turning, waking frequently, or not reaching deep sleep stages, you're not getting truly restorative sleep. Your skin needs you to cycle through all sleep stages, particularly deep sleep and REM sleep, for complete restoration. Let's talk about how to improve your sleep quality for better skin health. Create a consistent sleep schedule. Go to bed and wake up at the same times every day, even on weekends. Your body has a natural circadian rhythm that thrives on consistency. When you maintain a regular schedule, your sleep quality improves and your skin's repair processes optimize. Create a calming bedtime routine. This signals to your body that it's time to transition from wakefulness to sleep. Your routine might include gentle cleansing and skincare, changing into comfortable sleepwear, dimming lights, reading, gentle stretching, or meditation. Whatever helps you unwind, make it a consistent pre-sleep ritual. Make your bedroom a sleep sanctuary. Keep it cool, around 65 to 68 degrees. Fahrenheit is optimal for most people. Make it dark. Use blackout curtains or an eye mask to block all light. Keep it quiet. Use earplugs or white noise if needed. Invest in comfortable bedding. Your sleep environment significantly impacts sleep quality. Limit screen time before bed. The blue light from phones, tablets, computers, and televisions suppresses melatonin production, making it harder to fall asleep and reducing sleep quality. Try to avoid screens for at least an hour before bed. If you must use devices, use blue light filters or glasses. Be mindful of what you consume before sleep. Avoid caffeine after early afternoon. It can disrupt sleep even if consumed 6 hours before bed. Limit alcohol. While it might help you fall asleep initially, it disrupts sleep cycles and reduces sleep quality. Avoid large meals close to bedtime. Don't drink excessive fluids right before bed to minimize nighttime bathroom trips. Exercise regularly but not too close to bedtime. Physical activity improves sleep quality, but vigorous exercise too near bedtime can be stimulating. Aim to finish intense workouts at least 3 to 4 hours before bed. Gentle stretching or restorative yoga before bed is welcome. And take a moment to breathe. Let yourself settle into this peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. Now let's talk about the three main types of ingredients in moisturizers and how understanding these will help you choose the right product. First, we have humectants. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for adding hydration, for making your skin feel plump and supple. If your skin feels tight or rough, humectants can help tremendously. Second, we have emollients. Emollients fill in the spaces between skin cells, smoothing the surface of your skin and making it soft to the touch. They help repair your skin's barrier and make your skin feel comfortable. Ingredients like ceramides, squalane, and various plant oils are emollients. If your skin feels rough or flaky, emollients will help create that smooth, soft feeling you're looking for. Third, we have occlusives. Occlusives create a physical barrier on top of your skin that prevents water from evaporating. They're like that lid we mentioned earlier, sealing in all the hydration. Ingredients like petrolatum, mineral oil, and dimethicone are occlusives. They're especially helpful if your skin is very dry or if you live in a harsh climate. The best moisturizers contain a combination of all three types of ingredients. They hydrate with humectants, smooth with emollients, and seal with occlusives. This comprehensive approach addresses all aspects of moisture maintenance. Now, how do you choose the right moisturizer for your specific skin type? Let's go through each type slowly and thoughtfully. If you have dry skin, you need a richer moisturizer with more emollients and occlusives. Look for creams rather than lotions. Creams have a higher oil content and provide more intensive moisture. Your dry skin is telling you it needs more help maintaining its barrier and holding on to water. Ingredients like shea butter, ceramides, and hyaluronic acid will be your friends. Don't be afraid of products that feel rich and substantial. Your skin needs that extra nourishment. If you have oily skin, you might think you don't need moisturizer, but you absolutely do. Oily skin can still be dehydrated. In fact, sometimes your skin produces more oil because it's trying to compensate for dehydration. Choose a lightweight, gel-based, or water-based moisturizer. These formulas provide hydration without adding excess oil. Look for non-comedogenic products that won't clog your pores. Ingredients like hyaluronic acid and niacinamide work beautifully for oily skin. If you have combination skin, oily in some areas and dry in others, you have two options. You can use one balanced moisturizer all over your face, choosing a medium weight lotion that's not too heavy and not too light. Or you can use two different moisturizers, applying a lighter one to your oily zones and a richer one to your dry areas. Listen to what your skin needs and be willing to adjust seasonally. If you have sensitive skin, simplicity is key. Choose a moisturizer with minimal ingredients and no fragrance. Fragrance is one of the most common causes of irritation and allergic reactions. Look for products labeled as hypoallergenic and designed for sensitive skin. Ingredients like colloidal oatmeal, allantoin, and Centella asiatica can be particularly soothing. When trying a new moisturizer, always patch test it first on a small area of skin to make sure it doesn't cause irritation. Let's talk about texture for a moment because the way a moisturizer feels matters tremendously. You need to enjoy using your moisturizer, or you won't use it consistently. Some people love thick, rich creams that feel nourishing and substantial. Others prefer lightweight gels that absorb quickly and leave no residue. Neither is better. It's about what works for you and what you'll actually use every day. When you're testing a moisturizer, pay attention to how it feels immediately after application, and then how your skin feels an hour later. Does it sink in nicely or does it sit on the surface? Does your skin feel comfortable and balanced, or does it feel tight, greasy, or irritated? Your skin will tell you if a product is right. Trust those signals. Consider the time of day as well. Many people benefit from using different moisturizers in the morning versus at night. Morning moisturizers are often lighter because you'll be applying makeup or sunscreen over them. Night moisturizers can be richer and more intensive because your skin does most of its repair work while you sleep, and you don't need to worry about makeup application. Speaking of sunscreen, if your moisturizer contains SPF, that's wonderful for morning use. But remember that you need to apply enough to get the stated protection, about a quarter teaspoon for your face. Many people don't apply enough moisturizer to achieve adequate sun protection. So you might consider using a separate sunscreen to ensure you're fully protected. Let's address price for a moment. Expensive doesn't always mean better. Some of the most effective moisturizers are quite affordable. What matters is the ingredient list and how the product works for your specific skin. Don't feel pressured to spend a fortune. A drugstore moisturizer with good ingredients can work just as well as a luxury product. However, if a higher-end product brings you joy, if applying it feels like a special ritual that you look forward to, and if it works well for your skin, then it's worth the investment. Skincare should feel good. It should be something you enjoy, not endure. When reading ingredient lists, Remember that ingredients are listed in descending order by concentration. The first 5 to 7 ingredients make up the bulk of the formula. This is where you want to see your key moisturizing ingredients, your humectants, emollients, and occlusives. Be cautious of products that list water as the first ingredient, followed by many fillers before you get to any beneficial ingredients. While water is a necessary base for most moisturizers, you want to see nourishing ingredients high up on that list. One more consideration: seasonal changes. Your skin's needs vary with the weather and climate. You might need a lighter moisturizer in humid summer months and a richer one in dry winter weather. This doesn't mean you need to buy multiple products. Welcome, and breathe with me. Settle into calm. Today we're discussing an area of skincare that's often neglected, your neck and décolletage, yet these areas show age just as visibly as your face. Many people invest significant time and resources into facial skincare while completely ignoring their neck and chest. Then they wonder why these areas show aging more dramatically than their face. The truth is simple. Your neck and décolletage need the same care and attention you give your face. Let's understand why the neck and chest area is particularly vulnerable to visible aging. The skin on your neck is thinner than facial skin and has fewer oil glands. This makes it more prone to dryness and more vulnerable to showing signs of aging like wrinkles and sagging. Your neck is in constant motion. Every time you look down, turn your head, swallow, or speak, your neck skin moves and flexes. This repeated movement contributes to line and wrinkle formation. The décolletage, the area of your chest exposed by a V-neck or scoop neck shirt, receives significant sun exposure, yet is rarely protected with sunscreen. Sun damage here accumulates over years and becomes visible as brown spots, fine lines, crepey texture, and uneven tone. Many people sleep on their sides, which creates compression and folding of chest and neck skin night after night. Over years, this can contribute to chest wrinkles and necklines. The good news is that extending your facial skincare routine to include your neck and décolletage is simple and requires no additional products, just a change in application habits. Let's discuss how to incorporate neck and décolletage care into your existing routine. The simplest approach is this: whatever you apply to your face, extend down to your neck and chest. This includes every step of your routine. When you cleanse your face, continue down your neck. Use the same gentle cleanser, the same soft motions. Cleanse your chest as well, especially if you've applied sunscreen or products there during the day. When you apply toner or essence, don't stop at your jawline. Sweep it down your neck in upward strokes and across your décolletage. When you apply serum, whether vitamin C in the morning or retinol at night, include your neck and chest. These areas benefit from the same active ingredients your face does. They need antioxidants, they need retinoids, they need brightening ingredients. When you apply moisturizer, be generous with your neck and chest. Use upward strokes on your neck to work against gravity. Massage product into your décolletage with gentle circular motions. And crucially, when you apply sunscreen, which should be every morning, extend it down your neck and across any part of your chest that will be exposed. This is perhaps the single most important step for preventing visible aging in these areas. The key is making this extension automatic. Don't think of neck and chest as separate steps requiring separate products. Simply remember, if it goes on your face, it goes on your neck and décolletage too. Now let's discuss specific concerns for the neck and décolletage and how to address them. Horizontal necklines, sometimes called necklace lines, form from repeated folding of neck skin combined with natural aging and sun damage. Prevention through sunscreen and proper moisturizing is most effective. Once formed, these lines can be improved but not eliminated with topical care. Retinoids help by increasing collagen production and cell turnover. Keeping the area well hydrated helps minimize their appearance. For more dramatic improvement, professional treatments like radiofrequency, ultrasound, or injectables might be considered, but these require consultation with a dermatologist or plastic surgeon. Crepey skin, thin, wrinkled skin that resembles crepe paper, often affects the neck and chest, especially after sun damage. This texture issue responds to consistent use of retinoids, AHAs, peptides, and intensive moisturization. It takes time, months of consistent care, but improvement is possible. Prevention through sun protection and proper hydration is far easier than correction. Sagging skin on the neck, sometimes called turkey neck, results from loss of collagen and elastin, loss of fat volume, and gravity. Topical products have limited ability to tighten significantly sagging skin. Retinoids and peptides can help somewhat by supporting collagen. Some people see modest improvement with neck firming creams. For significant sagging, professional treatments or surgical options might be the only effective solutions. Prevention through early and consistent care is most effective. Chest wrinkles and lines, especially vertical lines between breasts, often result from side sleeping positions compressing skin night after night. Changing sleep position to your back can prevent new lines from forming. Using satin or silk pillowcases reduces friction. Applying retinoids and keeping the area moisturized helps existing lines become less pronounced. Some people use silicone patches worn overnight to smooth chest wrinkles. Age spots and sun damage on the chest are incredibly common because this area receives so much sun exposure over a lifetime. Brown spots can be faded with consistent use of vitamin C, niacinamide, retinoids, or AHAs. Sunscreen prevents new spots from forming and existing ones from darkening. Professional treatments like IPL or chemical peels can also help. Red or splotchy skin on the chest can result from sun damage, rosacea extending to this area, or sensitivity. Calming ingredients like niacinamide, centella, or azelaic acid can help. Avoiding triggers like hot showers, spicy food, or alcohol helps if you have rosacea. Consistent sun protection prevents worsening. Now let's talk about special considerations for this area. The neck and chest can be more sensitive than the face for some people. If you're introducing a strong active like retinol, you might want to start using it on your face first, then gradually extend to neck and chest once your face has built tolerance. Or use the product less frequently on these areas initially. Some people find that certain products that work beautifully on their face cause irritation or breakouts on their chest. This is individual and requires attention to your skin's response. You might need slightly different products for your décolletage than your face. If you have very sensitive skin, be cautious with fragrance and essential oils in body products applied to the décolletage. This area can be reactive. The neck area, particularly the front of the throat, is delicate. Be gentle with your application. Don't pull or tug. Use upward motions but light pressure. Let's discuss massage techniques for the neck and décolletage because these can be beneficial. As you apply products, take a moment to massage them in with intentional movements. This feels good, promotes circulation, and can help with product absorption and lymphatic drainage. For your neck, use both hands to stroke upward from collarbones to jawline. Use light to medium pressure, firm enough to be effective, gentle enough not to pull at delicate skin. Repeat several times. Massage the sides and back of your neck too, using circular motions to release tension and encourage circulation. For your décolletage, massage in outward and upward motions from the center of your chest toward your shoulders. Be gentle over the delicate skin between your breasts. This massage need only take a minute or two, but adds significant benefit to your routine. It transforms product application from a quick task into a moment of self-care. Let's address clothing and its role in protecting the neck and décolletage. Clothing provides physical sun protection. Higher necklines protect your neck and chest from sun exposure. When spending time outdoors, consider this in your clothing choices. However, regular clothing typically provides only moderate sun protection, roughly SPF 5 to 7 for most fabrics. For extended sun exposure, you still need sunscreen underneath your clothes, especially if the fabric is thin or loosely woven. Some clothing is specifically rated for UV protection. These garments provide higher SPF and are excellent for outdoor activities. Scarves and shawls can provide additional protection for the neck and chest when outdoors. This is both practical and can be stylish. Now let's discuss realistic timelines and expectations for improvement. If you've neglected your neck and décolletage for years while caring for your face, don't expect them to catch up to your facial skin overnight. Improvement takes time, several months of consistent care before you see significant changes. Prevention is always easier than correction. If you're young and starting comprehensive care now, your neck and chest will age much more slowly than if you wait to address these areas after damage has accumulated. Some changes, like deep wrinkles or significant sagging, have limited improvement potential with topical products alone. You can improve them somewhat, but complete reversal isn't realistic. Professional treatments might be necessary for dramatic changes. However, consistent care makes a real difference. 6 months of daily sunscreen, retinoid application, and proper moisturizing will show visible improvement in texture, tone, and overall appearance. As we come toward closing, remember that your neck and décolletage aren't separate entities requiring separate routines. They're simply extensions of your face, deserving the same products and the same care. Make it a habit. As you apply each product to your face, sweep it down to your neck and across your chest. This takes only seconds more and makes significant difference over time. If you've been neglecting these areas, start today. It's never too late to begin caring for your neck and chest better. They'll respond to good care at any age, though results come faster when you start earlier. Your neck and décolletage are always visible. They're seen by everyone you interact with. They tell your age as clearly as your face does, sometimes more so if they've been neglected while your face has received care. Give these areas the attention they deserve. They're part of you, they're always on display, and they'll reward consistent care with improved appearance and texture. Take a deep breath in and out. You now understand the importance of neck and décolletage care and how simple it is to incorporate into your existing routine. May you remember to extend your care beyond your face. May your neck and chest reflect the same attention you give your facial skin. May your entire self be cared for with consistency and love. Thank you for this peaceful time together. Extend your care, protect thoroughly, and appreciate your whole self. Hello, and welcome to this healing space. Let's begin with a gentle breath together. Breathe in slowly, drawing in calm and comfort, and breathe out, releasing any worry or tension. Today we're going to talk about something that many people are facing: how to repair a damaged skin barrier with patience, gentleness, and effective care. If you're here, your skin is probably telling you something is wrong. Perhaps it feels tight, uncomfortable, or perpetually dry no matter how much moisturizer you use. Perhaps it's become sensitive, reacting to products that never bothered you before. Perhaps you see redness, flaking, or a rough, dull texture. Perhaps your skin just doesn't feel like itself anymore. These are all signs of a compromised skin barrier, and I want you to know, this is repairable. Your skin can heal. You can restore its health and comfort. First, let's understand what happened. Your skin barrier, that protective outer layer made of skin cells and lipids, has been damaged. The protective wall has developed cracks. Moisture is escaping through these gaps, leaving your skin dehydrated. Irritants are entering through these same gaps, causing sensitivity and inflammation. Your skin is vulnerable right now, but with the right care, it will rebuild itself. What causes barrier damage? Sometimes it's harsh skincare products, strong cleansers, aggressive exfoliation, or too many active ingredients used too aggressively. Sometimes it's environmental stress, extreme weather, dry air, pollution. Sometimes it's lifestyle factors, stress, poor sleep, inadequate nutrition. Often, it's a combination of several factors. But here's the important thing. Regardless of how the damage occurred, the path to healing is the same. Repairing your barrier requires two things: stopping what's causing damage and actively supporting your skin's natural healing processes. Let's talk about both. First, you must stop the damage. This is non-negotiable. If you're still using the products or practices that damaged your barrier, you're trying to fill a bucket that has holes in it. The healing can't happen until you stop the harm. Look at your current routine with honest eyes. Are you using harsh, foaming cleansers? Are you exfoliating regularly with scrubs or strong acids? Are you using retinol, vitamin C, or other active ingredients? Are you cleansing multiple times a day? Are you using hot water? Any of these could be preventing healing. Here's what you need to do, and I know it might feel extreme, but it's necessary. Strip your routine down to absolute basics. Remove everything except 3 products: a very gentle cleanser, a rich barrier repair moisturizer, and sunscreen. That's it. Everything else needs to be set aside for now. I know this might feel scary. You might worry that without your acne treatment, your breakouts will worsen. Without your anti-aging serum, your wrinkles will deepen. Without your brightening products, your dark spots will become more prominent. But here's the truth. None of those products can work effectively on damaged skin anyway. The foundation must be repaired first. Everything else can wait. Let's talk about choosing the right products for barrier repair. Your cleanser should be extremely gentle, creamy, milky, or a non-foaming gel. It should clean your skin without leaving it feeling tight or stripped. If you're not sure whether your cleanser is gentle enough, on the side of caution and choose something even milder. Some people even skip cleanser in the morning during barrier repair. using just lukewarm water instead. When you cleanse, use lukewarm water only. Hot water, even warm water, strips lipids from your already compromised barrier. The water should feel neutral on your skin, neither hot nor cold. Massage the cleanser on gently with your fingertips for no more than 30 seconds. Then rinse thoroughly. Pat dry with a clean, soft towel. No rubbing, just gentle pressing motions. Your moisturizer is crucial during barrier repair. You need something rich, nourishing, and specifically formulated to support barrier function. Look for these key ingredients: ceramides, cholesterol, and free fatty acids. These 3 lipids are the primary components of your natural skin barrier. Applying them topically helps rebuild the damaged structure directly. Ceramides are especially important. Look for products that contain multiple types of ceramides: ceramide 1, ceramide 3, ceramide 6-2. The more types, the better. Some excellent barrier repair products are specifically formulated with the ideal ratio of ceramides, cholesterol, and fatty acids to mimic your natural barrier composition. Other beneficial ingredients for barrier repair include niacinamide, which supports barrier function and has anti-inflammatory properties; Centella asiatica, which soothes and promotes healing; colloidal oatmeal, which calms irritation and forms a protective film; panthenol, which hydrates and supports repair; and hyaluronic acid, which draws moisture into the skin. Apply your moisturizer generously. Don't skimp during barrier repair. Your skin needs abundant moisture. Apply it to slightly damp skin, ideally within 60 seconds of cleansing, to trap extra water in your skin. Press it gently into your skin rather than rubbing. Consider layering your moisturizer. Apply 1 layer, let it absorb for a minute, then apply another layer. This builds up deep hydration without feeling heavy. Many people find this more effective than applying a large amount all at once. At night, add an occlusive final layer to seal everything in. This could be a facial oil like squalane or jojoba, a sleeping pack, or even plain petroleum jelly. Occlusives create a physical barrier that prevents transepidermal water loss while you sleep. This nighttime protection is incredibly beneficial for barrier repair. Sunscreen remains essential, even during barrier repair. UV damage further compromises your barrier and slows healing. Choose a gentle, mineral-based sunscreen with zinc oxide or titanium dioxide if possible. These tend to be less irritating than chemical sunscreens. If your skin is extremely sensitive, look for formulas designed for babies or sensitive skin. Now let's talk about what to absolutely avoid during barrier repair. No exfoliation of any kind, no physical scrubs, no acids, no peels, no brushes, no active ingredients, no retinol, no strong vitamin C, no benzoyl peroxide, no salicylic acid, no harsh cleansers, no alcohol-based toners, no astringents, no hot water, no long baths, no saunas or steam rooms, no picking at flaking skin, no rubbing, no unnecessary touching of your face. This might sound restrictive, but remember, it's temporary. You're giving your skin a healing period, like putting a broken bone in a cast. Once your barrier has repaired, you can gradually reintroduce other products if desired. But right now, protection and support are all that matter. How long does barrier repair take? With consistent, gentle care, you should notice improvement within 1 to 2 weeks. Significant repair typically takes 4 to 6 weeks. Complete restoration might take 2 to 3 months, especially if the damage was severe or long-standing. Be patient. Your skin didn't become damaged overnight, and it won't heal overnight either. During the healing process, you might experience some purging of flaky skin. This is normal. Your damaged outer layer is shedding so healthier skin can emerge.